how did I start to study this subject? This baby, Joseph, was the one who started my study. Joseph had flat brain waves while he was still on the ventilator about 5 weeks after his delivery. We didn't take his organs. We didn't turn off his ventilator, even though his brain waves were interpreted as consistent with cerebral death. That's what was written on his chart. It did not make sense to me. So we continued to treat him. This is Joseph when he's about 7. And when Joseph went to school, he got straight A's, excellent grades. He ran track, he played baseball. This is Joseph as an adult and married, and they since have another child, so they have 3 children. Between 68 and 78, there were more than 30 different sets of criteria. Each set tends to become less strict than the previous set. The Harvard criteria in brain death is abbreviated in the literature these days as DBD, donation by brain death. The criteria became changed in several ways, but one you can readily understand. The Harvard criteria required 24 hours of observation. They shortened that time from 12 hours to 6 hours to 3 hours to 1 hour. And there's one set of criteria in the literature that they take them off the ventilator for 30 to 60 seconds. And if there is no evidence of breathing, that's considered sufficient for the declaration of brain death. The things have evolved to what's known as DCD, donation by cardiac death. What happens in those patients is they are not brain dead at all by anybody's criteria. But what they do is go to the relatives to get a do not resuscitate order, a DNR. Then they take them off the ventilator and they wait till they're without a pulse. Not until the heart stops. Not until the heart stops. The heart's still beating. They wait until there's not a pulse, that they don't record a pulse. How long do they wait? They have shortened that time down to as short as 75 seconds, 1.25 minutes in 2 babies in Colorado, where they took them off the ventilator and then after 75 seconds, proceeded to cut out the heart and transplant it to someone else. And then there is this thing called the apnea test. The apnea test is not a test for sleep apnea. That's the first thing. Strike that out. A lot of people have tests for sleep apnea, and you have friends or maybe even yourself that has sleep apnea. So it's not a test for sleep apnea, but what's the apnea test? It's part of every declaration of brain death. You cannot declare brain death unless they do the apnea test. Well, what's the apnea test? Well, the patient with the head injury that's on the ventilator is pushing the air in 15 times a minute. So every 3 to 5 seconds it pushes the air in. So the apnea test is they take away that support of the vital activity of breathing. They take it away. And remember, the person is getting it every 3 to 5 seconds. And so they take it away, not for 10 seconds, not for 30 seconds, not for 1 minute, not for 2 minutes, not for 5 minutes, but for 10 minutes. They suffocate the patient. And they suffocate the patient, and when they do that, the carbon dioxide goes up. And when the carbon dioxide goes up, we know that makes the brain swell and makes them worse. And they do this every time they declare somebody brain dead. And you need to know for yourself and your relatives, no apnea test. No one should ever get an apnea test. It's a test that's not done for the good and the health of the patient. It's done to declare them brain dead so they can get their organs.